This show is for general informational purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice. The content on this show is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice for any medical condition they have, and they should seek the assistance of their healthcare professionals for any such condition.
This is Rooted in Healing with Dr. Beth Claxton, exploring the science of functional medicine and the power of healing from within. Breathe in. Breathe out. And now your host, Dr. Beth Claxton.
Welcome back to Rooted in Healing. Thank you for tuning in today. I'm Dr. Beth Claxton. I'm a medical doctor, certified in functional medicine. And I wanted to start off today's episode about digestion, telling a story about myself. When I started my functional medicine training, we were all given these boxes that we sent in a stool sample and for a stool analysis. And when I set up my consultation with the doctor at the lab, the first thing they asked me was, how severe are your digestive problems? And I said, I'm not really having any digestive problems. And they said, you're not having pain or digestive difficulties? And I said, no. And so we went through the stool test, and the results showed severe inflammation and some extra things that shouldn't be growing inside of me. And it didn't make that big an impression on me until about 5 years later, when I ran across those test results and realized just how abnormal my digestion was. And I didn't even know it. And I see people every day who are in the same place that I was then, had no idea that their digestion is off. So we're talking to a brilliant individual today. Her name is Debra Meier. She's functional medicine certified, and her journey to functional medicine is different than mine. She's a physical therapist, and she was trying to find balance and wellness in her patients. And I'm really excited to share this interview with Debra today with you. And we're going to first jump to commercial break, and we'll be right back.
For more information on Dr. Beth Claxton, visit bethclaxtonmd.com. And now, more Rooted in Healing with Dr. Beth Claxton.
Hello and welcome to Rooted in Healing on Mellow Mountain Radio, KAZM 106.5 FM and 780 AM in beautiful Sedona, Arizona. I'm Dr. Beth Claxton. I'm a medical doctor, board certified in obstetrics and gynecology. I'm certified in functional medicine through the Institute for Functional Medicine. Today we have with us Debra Meier. And as a medical clinician trained to restore health and function, her educational background is in 3 separate disciplines: functional medicine, nutrition, and rehabilitation. And this education puts her in a distinctive position to guide all patients toward achieving their individual and unique health goals. Debra has a combined 30 years of hospital and outpatient rehabilitation experience, 16 years of nutrition experience, and 10 years of practicing the systems biology approach of functional medicine. Currently, through the creation of her private practice, Philadelphia Personal Health, Deb combines services from all 3 of her fields of expertise. She targets each individual patient's needs to maximize patient health outcomes. The services she offers patients are truly a personalized whole person care approach. Welcome, Deb.
Thank you very much, and thank you for having me, Dr. Beth. I appreciate the time.
Oh, you're very welcome. It's such an exciting thing every single time to talk about functional medicine with like-minded practitioners. And I'm curious if we can start by you telling us your journey into the functional medicine world.
Yeah, sure, absolutely. So as you read in my bio, I started in the world of rehabilitation as a physical therapist. I was always interested in the body and how it broke down and what we could do to fix it, more in the musculoskeletal range. And as I went through my career, and I did work in the hospital, so I was exposed to a number of diseases, not just sports injuries, and some neurologic, various things through I think I spent about 8 years in the hospital systems. And then I went more into orthopedics. And as I went through each decade, I found something very interesting happening where the patients that came into the clinic or the practice, mostly it was outpatient the last 20 years, had more and more comorbidities going on. They were sicker. They had diseases. They had a lot of medications they were taking. They were low on energy. They were probably heavier with more weight issues than 2 decades before. And I found when I was trying to rehabilitate these individuals based on, whatever their diagnosis was, that it became harder. And even getting them into the clinic at times, because, a lot of people that sustain orthopedic injuries are a little bit older and have families, people couldn't make it because their kids had some type of, virus or flu, or they were on the spectrum. Or so I was looking at the human, I know it sounds a little bit strange, but I was looking at the human species through a medical lens over 20 years, 25 years, and I was seeing a trend that was sort of disturbing to me. And, my question was, what's going on with the human race that we're, heavier, sicker, less energy, more disease prone, and we don't heal as well? And actually prior to functional medicine, I would say 16, 17 years ago, more than that now, 15, 20 years into my physical therapy rehabilitation journey, I was always interested in nutrition, so I went back to school and I became certified in nutrition. I was thinking that maybe it was food that had something to do with this. Yeah. So, and as being an expert in food yourself, that food has a lot to do with health.
It's part of it.
So I went back, big part of it. So then I was able to take my patients and I could talk about diet and nutrition, some sleep, things like that, because my nutrition program was also a wellness program. So I got certified in nutrition, and that moved the needle for patients a bit. It was more of a comprehensive program to recovery. And probably 5 years after that, a friend of mine who is a physician and an acupuncturist asked me if I've heard about functional medicine. She had something written up by Dr. Mark Hyman. And I had said, no, what is functional medicine? And she, I don't even know if she answered me, but she gave me a maybe 14-page paper or something written by Dr. Hyman, maybe Jeffrey Bland, about functional medicine and how it was a root cause to get to the deeper underlying issues of human health and the progression of disease. So I was fascinated and I read all of it. And I was like, wow, this sounds like something that is so needed on the planet, for people, whether you're a practitioner that is a board certified OB/GYN or a physical therapist or a gastroenterologist, a neurologist. Why aren't we looking more at root cause, and why are we looking and doing the symptom management? Right. So she encouraged me, because I was pretty comfortable in my career and doing well, but she encouraged me to look more into it. And then I Googled, and there was ISM.org, the Institute for Functional Medicine, and I was very interested, and I thought, can I do this? Like, is this something that I want to add to my plate going back to school? I think I graduated when I was 50, which is crazy, but I think I enrolled in the program at 46, something like that. And I didn't know if I could get in as a therapist, but they were, it was a program that is comprehensive and, multidisciplinary. So I enrolled, they let me in, and then I was like, oh, great. Oh no. And started that journey. And it's been 10 years since I graduated. And I have to say that my health because I have some autoimmunity in my family and myself, Hashimoto's. And so my health, my energy, my body composition, everything, my mom, my brother, patients, of course, it's just such a wonderful gift to have all that knowledge that you can sort of intervene as needed. And then I started my private practice, Philadelphia Personal Health. And that was 10 years ago, because I graduated about 10 years ago. It's amazing how quickly time flies. Yeah. And I didn't start out to be a specialist in gut health, and I still do practice sort of a multidisciplinary approach, energy, weight loss, sleep, autoimmunity, all those types of things through the functional medicine model. But the patients, half of them had gut dysfunction. I mean, maybe they had some other comorbidity with the gut, but everybody had stress and gut, right? So stress, insomnia, gut. So, here we are 10 years later, and I would say half or more of my patients are GI related. And so in that GI could be something as small as like indigestion and GERD, some pain, and as big as IBD, so irritable bowel disease, Crohn's colitis. And I have found that the functional medicine approach to digestive health, patients are so appreciative because it goes so much deeper than the standard colonoscopy or the upper GI endoscopy, where they're looking more at function.
Exactly.
Where they're looking more at anatomy and structure versus function. And then microbiome testing, when we went to DNA, that was a game changer. Yep. So now my practice is, it's a lot of GI, and you get a little bit better. Like, I don't know how many babies you've delivered, but you get a little bit better with each patient, right? Yeah, that teaches you teach them, they teach you.
Right.
So at this point in time, there's, I see a lot of various GI issues, and it's been really pretty successful with getting to the root cause of things. Testing is definitely something that enhances that, but also just listening to the patient's symptoms, hearing their story, getting that foundation that we do as certified functional medicine practitioners.
Right.
So, and I have found that when you treat the gut, that other things tend to also improve. Right, so that can be like a really good start point for a patient that's looking for generalized wellness.
Yes.
So that's my journey. I like going back to school. This is where I'm going to land, though. I'm going to stay here for a while.
Yeah. There's so many avenues, and I want to highlight something that you brought up. Functional medicine isn't just for doctors. When I was doing my training, probably true for you too, I would sit at a table with an acupuncturist, a naturopath, a dentist, a physical therapist, an RN, and we were all learning the same thing, and we were all going to go out and distribute this information differently to our different patients. So it's a movement, and it's a different type of thinking about health that can find its way into medicine so easily through so many different disciplines.
Yeah, I agree 100%. It's really that focus on the creation of health versus just the treatment of disease. And, we all know that, once a disease has a foothold, it's a little bit more difficult. And if you can catch things early and rebalance the body has an amazing ability to heal. We just have to sort of, what's the thing for functional medicine? If you take away all those things that are not healthy for you, right? Food, microbes, stress, relationships, but add in the things that are nutritious food, fiber, friendships, community, that the system sort of, there's an innate biological program in us for healing, and we have to tap into that. We get rid of the bad and we add in the good. Now, the nuance with all the training for functional medicine is identifying what those factors are. Right. And there's a saying in functional medicine, if you were sitting on a couple tacks and you remove and you have pain, you don't need ibuprofen. You need to take out a tack, right? And then the second part is, if you have two tacks that you're sitting on and you remove one, you're probably still going to have pain. So you got to look for the second tack, right? So we're investigators, I think, at heart, to look for those root causes and sort of get to healing on a deep level. So, and I agree. I meet at the conferences. I meet, plenty of MDs, NDs, naturopaths, and everybody's got something to offer. And like you said, we're all learning very similar curriculum. So it's been a wonderful journey for me. It's been, it was challenging, but it was, so worth it.
Yes. Yeah. Yes. Yeah. Thank you. So let's talk about gut health and really digestion. And why is it so important? Yeah.
Yeah. So I think, Patrick Hanaway, who was one of the founders, one of the sort of forefathers in, functional medicine, visited the clinic where I was doing nutrition 20 years ago. Mm-hmm. And, his words were, when in doubt, as a new person in functional medicine, start with the gut, right? And I was like, oh, but what if they have this or what if they have that, right? Mm-hmm. So now with 10 years of experience and finishing my program, it's like starting with the gut is so foundational because it affects your cardiovascular system. It affects your neurological system. It mm-hmm. affects your endocrine system. It affects your immune system. It really is. I think it's sort of undervalued too, like cardiovascular and neurologic issues get like all the press, but it's really digestive issues. I think that, have one of the biggest potentials to move the needle for overall health.
Yeah. So, and what people do is they go in and they get a colonoscopy and they're told they're fine. And then they come to see me and I said, they were looking at your colon with a TV. And so what we're going to do is look at it with a microscope and maybe even an electron microscope and figure out what's going on at a molecular level.
Yes, exactly. And the amount of microbes that inhabit the gut, they know now there's 40 to 100 trillion.
Right.
And these 40 to 100 trillion microbes, I look at them as you as the host are the CEO of yourself, your company, right? You're the leader. You're the person in charge, and you have 40 to 100 trillion workers, and of those 40 to 100 trillion with a T workers, they are either working in favor of your health, or they are sometimes just taking up space, not really creating health, not creating disease or symptoms. And then you have the group of microbes that can inhabit your GI tract that are actually actively causing inflammation, gut breakdown, higher risk for autoimmune disease. So of those 40 to 100 trillion workers, what you really want to know, and you alluded to this with, the looking at through like a deep lens microscope, is who are you carrying around with you? Who do you have with you in there that have such a profound influence on your health? And when we can see that, when we can illuminate that, I prefer DNA testing, PCR technology to really see everything. Then you can give the patient very actionable do's and don'ts for correcting microbiome imbalances, collectively called dysbiosis. There's insufficiency dysbiosis, infectious dysbiosis, a whole bunch of different terms we use to categorize what is going on in someone's gut. So, that's the advanced side of GI health and GI testing, taking that microscope and looking at the gut microbiome. But I think for clinical pearls for your listeners, and I love Hello Sedona. I love Sedona. It's a happy place for me. I've visited twice. So for your listeners, there are everyday things that you can do for gut health that can really move the needle. And, you don't have to do the sophisticated microbiome testing, although that's always great to know exactly what's going on. So if you want, we can sort of go through some of those things or talk about like how digestion works or, whatever.
Yeah, let's start with a tour. But I want to also mention that on the very first visit and at every single visit, everybody gets to answer the question, how are your bowel movements?
Yes, exactly. So we're I think you're a little bit younger than me, but we're not really at that age where we should be sitting around and talking about our bowel movements, but we do anyway, right? So it's
true.
like you got to look, right?
Right.
So when I'm talking to a new patient, and it's a digestive patient, it could be maybe 5 minutes into the consultation, and I look at the clock and I go, okay, Susan, I've known you for 5 minutes. Tell me about your bowel movements.
Right.
So
exactly.
So that always is, So I mean, we need to know, right? Information is knowledge is the key here in functional medicine.
Yeah.
So
what we're looking for. What we're looking for.
Yep.
Let's let people know what we're looking for is bowel movements that happen at least once a day, that are complete, that make you feel like you're really empty. And
complete evacuation.
And that are normally formed, that aren't necessarily mushy or rock hard, and that are a decent brown color, nothing black, nothing yellow. And what else do you have to add to that?
And there's a scale that you can look at online if you really want to get into this. Now, I unfortunately forget the name of it right now. Do you know what I'm talking about?
The Bristol.
Bristol, right?
Yes.
Exactly. So if somebody really wants to dig in a little bit and look at, like, match the pictures for their stool movements, it's the Bristol scale, which you can find online. So color matters, consistency, as you said, complete evacuation, and I don't think too many people, unfortunately, have that. So obviously, so from just a visual diagnosis standpoint, if you have really loose stools, right? That could be like an upregulated nervous system. That could be stress and anxiety. But I find more that that's like infection, like that's some microbes in there that have gotten a foothold and are overgrowing. Some things like super smelly stools, you want to think like Giardia and different infectious types of things. With the hard little pellet stools, you can think candida, you can think dehydration. So just knowing like the color, the consistency, the frequency can definitely give you clues to what is going on with the patient's digestive system.
Right. A lot of good information right there.
Yep.
So can you, or we can do this together, let's go on a little tour of the digestive system and all the places that where digestion is important, where it's important to enhance our digestion. And I think people will be enlightened for sure. Yeah,
sure. And we can go back and forth, or we can just sort of ad lib each. So why don't we do, high to low? We do high to low from an anatomical standpoint.
Yep.
Start with the head.
Yeah.
So, all right. So it's called a system because there's a number of organs that are involved, like your cardiovascular system, your endocrine system. So the digestive system has a number of organs involved, like most people think stomach, intestine, colon, but the first organ, and it's really important, is, as you know, your brain, right? So digestion can start in the brain because it is our nervous system, and a nerve that leaves the brain. We have 12 cranial nerves. Cranial nerve 10 is the vagus nerve, VAGUS. And the vagus nerve is part of the the parasympathetic nervous system.
Yes.
And if the vagus nerve isn't firing, digestion is dialed down. So a lot of people don't realize, I feel a lot of people don't realize that body systems are turning on and off all the time based on need and the signals that we give our body. So digestion and digestive fluids aren't being made all the time. They start to be made when we think about food, or they really start to crank up when we begin to eat. So the brain, the vagus nerve, the longest cranial nerve, leaves the head and innervates the gut. It innervates every single organ in the gut, and it is sort of the power switch to turn it on if it's firing, if you're relaxed, or not firing if you're in a stress mode.
Mm-hmm.
So stress and digestion, they don't mix very well.
Right.
So the brain is the number one organ for the start of digestion by activating the vagus nerve. And, for a clinical pro, for people that are listening, there are a number of resources online where you can say vagus nerve exercises for better digestion. And it'll take you to things like deep breathing, humming, gargling, all the things that activate the parasympathetic nervous system. So brain.
Yeah. Yeah, great. And it also, the vagus nerve innervates the pancreas. It innervates the stomach for release of
the pancreas,
acid.
Gallbladder, liver, intestinal tract.
Yeah.
So the system, it's really controlling the system,
right.
The entire system. So,
Right. So we need to be relaxed when we eat.
Mindful. Yeah. Well, and I tell patients too that when you eat, you have to have the system on to make the digestive juices to take food and turn it into people parts, right? So, a carrot, a piece of steak chicken has no use in your body unless you digest it fully, and that takes output from the mouth, the stomach, the pancreas, the liver via the gallbladder, right? And then there's, so all these digestive enzymes and juices have to be secreting, and they won't secrete well if you're not in that relaxed state. And one of the things I tell people too, just as a bring it home, is if you have food in your system and if you're upset, you're not going to be digesting.
Right.
And if you're really upset, you could even vomit, right? We've seen people vomit if they see something, horrible, because the digestive system just doesn't work when you are in stress mode. And in everyday life, stress mode doesn't have to be running away from a tiger or anything. It can be the deadline. It can be the worry. It can be, sitting in your car and gulping down a sandwich or something, or, multitasking. So there is a book called Food Rules that Michael Pollan wrote. Small book, but it talks about, how to eat, right? We've forgotten sort of how to eat, I think, with this rushed world that we're in.
Oh, that's good. Good resource. So, and then the next thing that I'd like to highlight is the nose and our eyes. And when we look at the food, we smell it and we start to appreciate it and get ready to eat.
Yes, exactly. Preparing. Yeah, those signals, those, again, cranial nerves, the eyes, the smell. Then we start that salivary process in our mouth. Right. So if we're coming from the head down, the mouth is the next place, and we have the salivary glands that digestion begins there. We have mastication, right? Our molars, primarily our molars, are going to crush the food to create surface area to allow better digestion and breakdown.
And another word for mastication is
chewing. I'm sorry, chewing. Yes. Yeah. Thank you. So chew. You have to chew, right?
Yeah.
So you have to chew your food, because if you have a big chunk of food in the digestive tract, it's much harder to break down than if you have food that is pretty well prepared for digestion by chewing. When you chew too, and you keep food in the mouth a little bit longer, you're going to get the amylase that the salivary glands secrete, and that's going to coat the food and start the digestive process. The saliva also aids in, transport to the stomach, so it makes food slippery, so it doesn't get stuck in your throat. So chewing your food, and then swallow to get to the next stage in the break down food and make people parts.
So let's talk about chewing. How many times? Let's get really granular.
Do you have TMJ, or is your jaw? So, chewing, I think enough to, there's some people that say chew 100 or something. I find that's not practical for most people.
Right.
What's that, macrobiotics, I guess. So, I think different food needs to be, it depends. If it's a soft food, then, a little less chewing, right? Soups, stews, smoothies. But if it is a hard food, like it's a vegetable base or it's a meat, especially the meats. They're one of the hardest to break down. You want to get steak and chicken to look like ground meat, right? You want to, so I don't do a specific number. Just, it has to be fully coated with saliva. Do you do a specific number for how many chews before they can swallow?
I was taught 30. Recently, I was introduced to 40, and I've been counting myself as I eat and realizing sometimes 40 isn't enough.
Interesting.
Just, once we start to appreciate what's happening, you can realize it's really not completely broken down.
Yeah. So I think 30, 40 for more, difficult things to break down. And then, the person has to, what I wouldn't want is like, they have 20 minutes to eat because it's their lunch break, and then, they have to. So I think it can be personalized too for that. But the more you chew, if you've got the time, chew and keep chewing till you've got something like really soft in there, covered in amylase and saliva, and then swallow.
Yeah.
So I feel that a lot of the work for digestion, like the next stop after the esophagus, the stomach, is like so key. I see a lot of patients with stomach issues.
Right.
And did you want to talk more about anything in the mouth, or?
Well, one thing is the esophagus. I know myself, if I am rushing around and I try to eat, my esophagus just doesn't want to transport it into the stomach.
Yeah. Well, that rushing, you're not creating the slippery. Even taking a supplement, like I have people like just take and they put it in their mouth and they swallow, and it sticks in the esophagus because it's not coated with the saliva, which is nice and slippery. So one more reason to chew a little bit longer. Yep.
Yeah, and relax. Yes. Okay. Stomach. This is like.
So what happens? What happens in the stomach, right? So. The stomach is, it's one of my favorite organs of digestion. I'm sure that sounds a little geeky, but so the stomach produces a substance called hydrochloric acid. The pH in the stomach is a 2. It's a super acidic environment. Like the pH is 7 is neutral, right? Higher is alkaline, lower is acidic. The hydrochloric acid in the stomach is largely, I think, responsible for protein digestion. And proteins are one of the hardest. We have 3 forms of food macronutrients: protein, carb, and fat. And the protein can be difficult to digest because it needs a lot of acid to take that protein and break it apart to form amino acids, because our body can use amino acids to rebuild so many tissues, right? So we use amino acids or bits of protein, if they're broken down well in the stomach, to rebuild our flesh, right? Rebuild our muscles, rebuild our organs, rebuild our skin, right? So we need amino acids. They also, there's amino acid base that creates all our immune cells, our red blood cells, our white blood cells. It's an amino acid base that makes our neurotransmitters. It's an amino acid base that makes our hormones. So we are made out of protein. So we need to not just intake protein, but we need to digest it to rebuild our body. And that happens in the stomach. Mainly the most protein digestion is in the stomach because we make acid, and that can break apart the proteins and create amino acids that selectively rebuild various different tissues and make different signaling substances. So the stomach makes acid. Now, if you're, as we talked about before, if you're stressed and the vagus nerve isn't activated, then the stomach and the other organs aren't really turned on. So you don't have a lot of acid being produced in your stomach. Other things can decrease stomach acid: H. pylori infection, candida, low B12, age. We start to make less stomach acid. So a little bit more important as we get older to really relax when we're eating. Dehydration decreases stomach acid production. So we want to be hydrated, but we don't want to drink a lot of water when we eat, because we're making stomach acid, we're making digestive enzymes, we're making bile acids, various organs. And we don't want to really dilute all of those. We want to let them do their job well. So now the stomach makes the acid. It also makes pepsin, right? Hydrochloric acid and pepsin to do a really good job on breaking down proteins and your other foods. But the stomach has a barrier. It has a mucosal layer because your stomach is made out of, your body's made out of protein primarily. And you would self-digest your stomach if you didn't have this protective barrier. So you need the mucin layer. You need the parietal cells making the pepsin, making the mucin, making the hydrochloric acid. And there's one infection out there that really seems to block all that, and that's called H. pylori. And a lot of people do have H. pylori infection. So I feel like the stomach is key. If we don't make the acid, we're more likely to get SIBO. If we don't make the mucin, we're going to have sort of a sour, raw stomach. The pepsin, again, for the hydrochloric acid, for the protein breakdown.
Yes.
So,
two quick points. Oh, sorry.
Yeah.
The H. pylori. I want to make sure people know that sometimes you can have a colonization of H. pylori, and if it's not causing any problems, it can be okay.
Commensal.
At low concentrations,
absolutely.
It can be fine. So not everyone that tests positive for H. pylori needs to be treated. And that pH of 2, like that's super duper strong acid. Like that would take paint off a car, right?
Yeah, exactly. But the stomach can handle that. So that's like, stomach's a little bit of my hero, I think.
That's how we're made, right? Okay, thank you.
Yeah, and in general, acid keeps microbial overgrowth at bay because most microbes like a certain acidity, right?
Yeah, these are bacteria.
And 2 is too right, bacteria, and 2 is too low. It's very acidic. I mean, that's the movie where they're doing the acid bath for the gangster type of thing. So, so H. pylori uniquely can live in the stomach and hurt the ability for the stomach to produce acid because it forms a thick mucus plug around itself to protect it from the acid. So microbes have survival strategy. Right. I tell people when we're going after harmful microbes that, that there's going to be like a push fat. That's where the low FODMAP diet comes in to weaken them a little bit before removal. Yeah. So it's a very acidic environment. Now, at times, somebody needs to lower acid. There's a lot of PPIs, protein pump inhibitors that are prescribed, or H2 blockers. These are antacids prescription,
right?
And that can be used for a while if you have something like Barrett's esophagitis or an ulcer, or the beginning of an ulcer stage. But those drugs aren't really meant to be used long term because without the acid, we're not getting good digestion, and without good digestion, we don't have good absorption. So maldigestion, or the inability to fully digest your food, leads to malabsorption, and then there's nutrient and other problems that can go on with that. Yeah. So
the downstream effects.
So, absolutely. Yeah.
And then we go into the amazing part of the small intestine called the duodenum. I just think this is a fascinating place.
Yeah, there's a lot happening there too.
Right. Yeah.
Right. It's like, so that's where we see more breakdown in the upper intestine of, and there shouldn't be a lot of microbes up there, right? Because you've got a ball of acidy food chyme leaving the stomach and going into the duodenum, and you have coming into the upper. It's the first part of the small intestine after the stomach. You have more digestive juices or enzymes being put in. So your pancreas is making amylase, protease, and lipase to break down fats, carbs, and proteins, more protein digestion. And those enzymes get put into the small intestine at the top. And your liver is making bile, and then it stores the bile in the gallbladder. And then again, when food arrives in the small intestine, what's happening is the bile gets secreted, and the bile helps you break down fats. So liver, gallbladder for bile and fat digestion, stomach for mainly protein, but other too, and then the pancreas for amylase, protease, and lipase. So all of these organs, plus we talked about the brain and the saliva, are all working together to convert food to something that is broken down far enough and complete enough that we can rebuild our bodies with.
Yeah, so amylase breaks down carbohydrates, protease breaks down protein, lipase breaks down fat, and then what bile is like soap. And it comes in and it just sort of separates everything so that things aren't sticking together as much, and all of the enzymes can really get in between the fat and the globs of food called chyme to really start to break it down. And then it starts to go down the small intestine.
Yep, exactly.
Yeah.
So the small intestine in the upper part there's a lot of secretions and more digestion. And the small intestine is about 16 feet. Stomach's maybe 12 inches by 6. Small intestine, I think, is about 16 feet long, give or take. And then the large intestine, after the small intestine, is, I think, 6 feet, 6 feet. So small intestine is a pretty long journey for food, and it's in the upper part that we see most of these digestive enzymes coming in, the bile acids, right, amylase, protease, lipase. And then the food, it's time to absorb, right? So our goal with all these secretions is to break food down, right, to its component parts. And now the small intestine has something, there's some in the large, but more in the small intestine. The small intestine has something called microvilli, right? So it looks like the shags on a shag carpet. And they're there, they absorb different things, right? They're absorbing your amino acids, they're absorbing, so your proteins, they're absorbing your fats, right? So hopefully healthy fats, your essential fatty acids, and they're absorbing your carbohydrates. But if you've broken the food down enough, there's also vitamins, minerals, and phytochemicals now that were liberated from the food that you're also pulling in through your microvilli into your body to, create health and repair and rebuild tissue.
Right.
I think a lot of people also feel like you have this body and they don't necessarily have to think about it, like we're hopefully getting them to think about it, but they have this body and it's their body and they have it and it's just going to be there. But there's a constant need for these nutrients, right? And proteins, fats, and carbs and phytonutrients to rebuild tissue. Right, so your lining of your GI tract, I think it turns over every 4 or 5 days, right? So your skin, you're always building new tissue. A red blood cell lives for 3 months, a white blood cell about 6, right? So you have to keep making new everything.
Right.
You have to make new neurotransmitters. You have to make new hormones. You have to make new liver cells, kidney cells, skin cells, eye cells, brain cells. And how do we rebuild all of our tissues? Food. Yeah. So food that is digested and absorbed. And, the saying for computers, junk in, junk out. So if you're not eating those healthy whole foods, what your body's breaking down and absorbing, you're likely getting enough calories, but not enough of these essential nutrients to really rebuild the tissues that you need to remain healthy and strong, like your organs. Your signaling substances. So that absorption all happens in the small intestine through the microvilli. Well, some things happen lower down, but mostly in the small intestine.
Yeah, and can you believe it? We're already getting close to time. So there's a couple highlights that I'd like to make about the small intestines. That there are a lot of folds in the surface area of those microvilli, like the surface of all of them. That's the surface area through which all these nutrients are absorbed. And if you spread it out, it's the size of a tennis court.
Tennis court, yes, exactly. Yeah,
so we have a lot of surface area to absorb a lot of nutrients in our body. So we need to give our body what it needs, right?
Yep, exactly. So, and then as we continue on in Trent, we go from the small intestine. Hopefully we digest it so we can absorb. Yep. And now we have to eliminate, right? So the large intestine, also called the colon, right? There's a couple parts to the colon, but large intestine is usually referred to as the colon and ending in the rectum. So this is where we gather waste and we reabsorb. We reabsorb water, right, some electrolytes, so the colon has its own function. And our microbiome, 42 trillion, 40 to 100 trillion microbes, primarily should exist in the large intestine, right, in the colon, right? We shouldn't have a lot of microbes in that small intestine or in the stomach. That should be pretty, clean up there for digestion and absorption.
Right.
So the one point that I would like to emphasize as far as food and the colon health goes is that when people eat a lot of processed foods, those foods that are, bagged, barcoded, your pretzels, cookies, your flours, your muffins, those types of things, pizzas. So when you eat foods that are processed, it changes the pH in the colon. It raises the pH in the colon, and then microbes can grow that are unfavorable to health. So processed foods increase the colon pH, and then they're called collectively proteolytic bacteria can grow, and proteolytic bacteria produce things like we did up in the upper part. So proteolytic bacteria produce enzymes that break down protein. Now, the colon doesn't have so much protection, and if we have proteolytic enzymes in the colon, it can lead to something called leaky gut, right? So you're digesting proteins with proteolytic enzymes because you got them from, processed foods, and now you're sort of destroying that single cell barrier from the little stool that's in the colon from the body's tissue. So you can get translocation of some not so friendly things, bad bacteria, different foods from the colon into your system. Then you have to detoxify if you eat a lot of processed foods.
Wow.
Conversely, if you eat fiber-rich foods, it will drop the colon pH a bit, and you will create the right microbes that produce something called short-chain fatty acids like butyrate, and that rebuilds the colon lining and keeps you protected from, waste moving into the bloodstream. So short-chain fatty acids come from foods that are fibrous, right? So fiber-rich foods really protect the colon, decreases the risk of colon cancer, increases your production of GLP-1s, right? We're all taking GLP-1s. Well, you make them naturally if you eat a lot of fibrous foods, right? Rebuilds the colon lining. So fiber foods rich in fiber are so much healthier for the digestive tract and the colon because of the bacteria that they feed. Processed foods change the pH, allows different types of bacteria to be in there, and can be, the beginning of something called leaky gut and some things that just, create other health issues that can spread throughout the body, basically. So the type of food you eat really matters, and if we can have less processed and more natural foods, then your entire GI tract is so much healthier.
Yeah, great. Well, thank you, Deb, so much for your time today on Rooted in Healing at Mellow Mountain Radio, KZM.
We'll be right back with more Rooted in Healing right after these commercial messages. And now, more Rooted in Healing with Dr. Beth Claxton.
Thank you for tuning in today. I'm Dr. Beth Claxton. You've been listening to Rooted in Healing. Today we were listening to my interview with Debra Meier, who's a physical therapist who evolved to functional medicine to really help her patients find the root cause of their imbalances. Debra can be found at Philadelphia Personal Health if you want to know more about her. She is such a brilliant individual, and I enjoy every moment that I get to chat with her. I hope that you take away a lot of good information from our interview today. And I'm really excited about my next interview with Greg Blommel, who's a medical doctor in Wisconsin, and he's certified in lifestyle medicine. Lifestyle medicine is another modality where we can reach our patients through another way besides prescriptions and testing and surgeries. He's reversing people's diabetes with their diet. He teaches cooking classes to his patients, and I'm really looking forward to this interview. If you're interested in finding out more about me or becoming a patient, we can take a deep dive into your health. We can evaluate your labs. Even if you're not feeling out of balance, we can just check and see what's going on and potentially see what's going to happen in the next 10 years based on what we're looking at now. If you're feeling out of balance and you can't quite get the answers, check out BethClaxtonMD.com, click on Become a Patient, and schedule a connection call. I'd love to get to know you better. And that is our time for today. You've been listening to KAZM, Mellow Mountain Radio, 106.5 FM and 780 AM. Tune in next week on Saturday at 9 a.m. I'll see you then. Until next time, keep finding and searching for that which makes you feel vibrant.
For more information on Dr. Beth Claxton, visit BethClaxtonMD.com.